Welcome to our 6-part training series on respiratory protection. For this first section, we'll be discussing general infectious disease and workplace safety principles for healthcare workers. We're grateful for feedback and we hope you enjoyed the modules. We'd like to thank the following individuals and institutions. We'll first present an overview of workplace safety and health for healthcare workers, focusing on infectious diseases. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. We hope that by the end of this module, you'll achieve these learning objectives. Occupational health is a branch of public health. We identify hazardous exposures and their health consequences, and determine how to prevent adverse effects. Occupational hazards can come in many forms. Safety hazards are those exposures that cause injuries. They can include a range of hazards, from slips, trips and falls, to explosions or fires that lead to fatal and non-fatal injuries. Health hazards cause diseases. Health workers can be exposed to chemical hazards such as bleach and other disinfectants. Hazards that are studied with physics include radiation, noise, and heat. The most common hazards are biomechanical hazards, especially lifting. Psychologic hazards may range from witnessing suffering and death to harassment or bullying. Biologic hazards are particularly important for healthcare workers. Infectious diseases present additional concerns, since infected healthcare workers can transmit disease to family, colleagues, and patients. To prevent healthcare workers from becoming infected, we need to understand what the agent or pathogen is, how it is transmitted between people, whether there are ways to improve the healthcare workers' ability to fight off the infections, how the environment affects the agent, and how to control or reduce the hazard. There are many types of organisms that can cause infectious disease. For example, viruses can cause diseases such as Ebola, measles, and hepatitis B. Bacteria can cause tuberculosis, forms of pneumonia, and other infections. Organisms can cause illness either directly or through the production of toxins. A healthcare worker is anyone who helps care for the sick, including doctors, nurses, aides, helpers, laboratory technicians, janitors, housekeepers, and clerks, anyone who comes into contact with patients. These are diseases that healthcare workers are familiar with. The agent is the infectious organism. Some of the differences in disease transmission or severity occur because different agents are more invasive, may require a lower infective dose, or survive differently outside the body. Since hepatitis B is a sturdy virus that can survive outside the body, the risk of infection from a blood-to-blood needle stick exposure is 100 times greater than the risk from an exposure to HIV, which is a more fragile virus. However, there is a safe and effective vaccine against hepatitis B that all healthcare workers should receive. Healthcare workers may be exposed in different ways, and some agents may have more than one route of entry. Hepatitis B and C, for example, may be transmitted through mucous membrane exposure, as well as through needle stick or sharps exposure. Hepatitis A is transmitted through ingestion of food or water contaminated with fecal material. Immunization is an important approach to protecting healthcare workers from infectious diseases. People can also become immune after having the disease, or through receiving antibodies from others who have once been infected. A variety of health conditions can make an individual more susceptible to some infections. Age is also an important factor of host susceptibility. In Liberia, the Ministry of Health has developed national infection and prevention control guidelines, which take a comprehensive approach to identifying and reducing hazards for both patients and for healthcare workers. The chain of transmission relates how pathogens may be transmitted to susceptible hosts, and what reservoirs might be available for pathogens to multiply in. Transmission can take place in different ways for different agents. Some agents have more than one method of transmission. Contact transmission includes direct touching and touching common surfaces. It also includes having droplets from an infected individual that strike the eyes, nose, or mouth of an uninfected individual. This can take place when people are closer than 6 feet apart, and the droplets can be spread by sneezing, coughing, or even just by talking. Contact transmission can also be indirect, through touching common surfaces. Common vehicle transmission can occur through contaminated food or contaminated multi-use medication vials. Airborne transmission is also possible for certain pathogens. If an organism can survive once the droplet dries out, it can float in the air for longer periods of time and can be transmitted through breathing. Both measles and tuberculosis can be airborne. There is still discussion about diseases such as influenza, which are known to be droplet spread but are also shown to be airborne with emerging research. Lastly, other diseases such as malaria and yellow fever can be transmitted through vectors like mosquitoes. This diagram shows direct contact, droplet, and airborne transmission. You can see that in contact transmission, germs are transferred from one infected person to another person through touch. Indirect contact is not shown on this slide, but includes touching common surfaces, like doorknobs. In the next panel, droplet transmission, respiratory droplets are generated when this infected person coughs, sneezes, or talks. If the droplets reach the eyes, nose, or mouth of another person, this person can be infected. Droplets are relatively heavy and drop to the ground quickly. They don't travel further than 6 feet, which is why 6-foot distancing is important for protection wherever possible. Lastly, airborne transmission is the distribution of small airborne particles which can be breathed in by another person. Some agents survive when dried into very small airborne particles and can remain suspended in the air for minutes to hours. These can be breathed in by another person and can travel beyond the 6-foot distance limit for droplet spread. Droplets are large and fall to the ground rapidly unless they strike another surface. However, they also dry out quickly. Smaller particles, called droplet nuclei, float in the air. If the infectious agent can survive in these tiny particles, they can be transmitted through airborne spread. The important question is whether the dried out particles remain infectious. Some agents do, others don't. Let's focus now on the novel coronavirus that is causing the current global pandemic. There are now 7 coronaviruses that affect people. The first 4 here are one of the many causes for the common cold. They have been in humans for many hundreds of years. However, the newer coronaviruses that have only recently infected humans are much more severe. They can cause diseases such as severe acute respiratory syndrome, known as SARS, Middle Eastern respiratory syndrome, known as MERS, and the novel coronavirus SARS-CoV-2. Many other coronaviruses are still zoonotic only, mostly in bats, but also in other mammals and birds as well. So what do we know from other coronaviruses? We know that the coronavirus is enveloped, which makes it more susceptible to disinfection. It has multiple routes of transmission, for example, droplet and fecal-oral transmission. SARS coronavirus is also likely to be transmitted through surfaces and airborne methods. Research on the novel coronavirus is providing new information on a daily basis. What we know today, in August 2020, will change and will need to be updated. The virus itself is named SARS-CoV-2. The disease is called COVID-19. A major problem with this disease, unlike with MERS and SARS, is that infected individuals may shed the virus even when they are asymptomatic or pre-symptomatic. When individuals are symptomatic, there's a variety of presentations. The most common is respiratory disease, which can cause fever, cough, and trouble breathing. The disease has a broad range of severity and is worse in the elderly. Men are also at greater risk. Other risk factors include pre-existing conditions. Unfortunately, current data suggest a disproportionate burden of illness and death among racial and ethnic minority groups in some countries. The virus can affect many organ systems. Some affected individuals report loss of taste or smell, headaches, and lightheadedness. Some individuals experience abdominal pain, nausea, vomiting, and diarrhea. The virus has been found in the stool of patients with gastrointestinal disease, as well as those with respiratory disease. Some people have developed conjunctivitis after droplet exposure to the eyes. This chart is useful to help distinguish symptoms of COVID-19 from other common conditions such as the flu, the common cold, and allergies. Feel free to pause the presentation at this moment to review the table in more depth. Various routes of transmission have been documented for COVID-19. To combat droplet and contact transmission, measures can be taken like social distancing, face shields and masks for healthcare workers in primary care settings, and the use of masks for source control in primary care triage and transport. Frequent cleaning and hand washing can help prevent COVID-19 from being transmitted through common surfaces or through fecal-oral routes. Lastly, when healthcare workers are exposed to ill individuals, the risk increases for airborne COVID-19 transmission. Measures for respiratory protection are important for healthcare workers in isolation units and other high-risk settings. Once we understand the problems hazards cause, we can look for interventions for prevention. A systems approach using the hierarchy of hazard controls is an effective approach. The hierarchy of controls aims to minimize or eliminate exposure to hazards. Here is a popular diagram depicting the hierarchy of controls. You can see that the elimination of the hazard is the most effective control, while PPE is the least effective. PPE is the lowest on the list because it depends on the individual to use it properly each time. It can also be uncomfortable, but it is often necessary, especially in healthcare settings where elimination of the hazard may be difficult or impossible to achieve. If possible, reducing host susceptibility is an important way to reduce risk. Both active and passive immunization and use of medications for pre-exposure prophylaxis or post-exposure prophylaxis can be effective. Some of these approaches are used for HIV, tuberculosis, anthrax, and other diseases. Scientists are actively looking to identify similar protections against COVID-19. Now that we have discussed the various methods of transmission, we can talk about precautions that can be taken. These precautions include engineering controls, such as negative pressure rooms for patients with airborne transmissible diseases, administrative controls, such as providing soap, water, and cleaning protocols for equipment. They can also include the use of personal protective equipment. Worker protection is a hallmark of high-performing organizations. Organizations that excel embrace a culture of safety. They recognize their duty to protect both healthcare workers and patients. Part of this includes a strong commitment to leadership and communication with everybody involved in patient care. Everyone has a voice, and every voice is valuable. These recommendations come from a workshop of healthcare leaders, workers, union representatives, and patient representatives meeting to discuss how healthcare worker safety and patient safety are related. One principle is that leaders are critical to implementing person safety for patients, staff, visitors, contractors, and everyone who enters the facility. So, it's important to start at the top. Second, frontline caregivers provide important insights about the patient. Data is also critically important to identify problems and to make sure that solutions are working. Workers need to know how to do their jobs well as how to do them safely. The concept of a just culture is one that does not punish human error, but instead attempts to address the error by examining how it occurred. A multidisciplinary approach enhances quality and safety. Finally, prioritizing the most important problems and working to address them helps programs achieve visible success. Workplace safety requires a coordinated, integrated, systems approach. The main components include management leadership, worker participation, hazard identification and remediation, education and training, program evaluation and improvement, and communication programs. Let's now summarize some of the main ideas we discussed in this module. The primary routes of transmission for infectious diseases are contact, droplet, airborne, vector, and common vehicle. Contact precautions include hand hygiene, gown, and gloves. Droplet precautions have the added requirement of eye protection and a face mask. For airborne precautions, a filtering respirator, such as an N95 or elastomeric respirator, must be used instead of a face mask. Eye protection is also important in airborne precautions. A systems approach to occupational safety and health uses the hierarchy of controls. Here are some additional resources.